Did you know that a simple lack of calcium in your diet could be causing more than just brittle bones? It might be silently triggering dangerous health issues that can affect your heart, brain, and overall well-being. Most people think of osteoporosis when they hear about calcium deficiency, but the truth is the symptoms can be far more severe and even life-threatening if left unchecked. I am V, and today we're diving into a critical topic that doesn't get nearly enough attention: calcium deficiency. While most of us are aware that calcium is essential for strong bones, there are some alarming signs your body might be giving you when it's starved for this vital nutrient. And trust me, these signs are more serious than you might think. In this video, I'm going to walk you through the severe symptoms of calcium deficiency that you should never ignore. We'll explore why calcium is crucial not just for your bones, but for your heart, nerves, and muscles too. By the end of this video, you'll know exactly what to look out for and how to protect yourself from these hidden dangers. So, if you're ready to take control of your health and learn the warning signs your body might be sending you, keep watching. And remember to like this video, subscribe to the channel, and please share with your family and friends. Let's get into it. What is calcium deficiency? Calcium deficiency, also known as hypocalcemia, occurs when your body doesn't have enough calcium to perform its vital functions. Calcium is the most abundant mineral in the body, and it's critical not just for your bones but for muscle function, nerve transmission, and blood clotting. When your calcium levels drop too low, your body starts pulling calcium from your bones to maintain these essential processes, leading to a range of health issues. Most people associate calcium with strong bones, and while that's true, its role in the body goes far beyond just maintaining bone density. Calcium is crucial for your heart and muscles to function properly. It helps regulate your heartbeat, allows your muscles to contract and relax smoothly, and supports nerve communication throughout your body. Without enough calcium, these systems can start to malfunction, leading to severe health problems. Why calcium deficiency happens? Calcium deficiency can develop for a variety of reasons. One common cause is simply not getting enough calcium from your diet. But there are other factors at play too. Sometimes your body might not absorb calcium properly due to conditions like Crohn's disease or celiac disease. Certain medications can also interfere with calcium absorption. Additionally, as we age, our bodies become less efficient at absorbing calcium, which increases the risk of deficiency. While many people know about the risks to bone health, there are other, more severe signs that you need to be aware of, some of which could be life-threatening if not addressed. Let's take a closer look at these symptoms and what they mean for your overall health. Common signs of calcium deficiency. Bone health issues. When most people think about calcium deficiency, the first thing that comes to mind is weak bones. And that's for a good reason. Without enough calcium, your bones become more porous and fragile, leading to conditions like osteoporosis and an increased risk of fractures. You might start to notice that you're more prone to bone breaks, or that your posture is gradually worsening over time. This is because your body is pulling calcium from your bones to keep other essential functions going. Muscle problems. Calcium plays a crucial role in muscle function, so when levels are low, your muscles can start to act up. Common signs include muscle cramps, especially in the legs, and spasms that can happen out of nowhere. You might also feel general muscle weakness, or even a persistent sense of fatigue. These symptoms are your body's way of signaling that it's struggling to maintain normal muscle function due to a lack of calcium. Nail and hair changes. Your nails and hair are also affected by calcium levels. If you notice that your nails are becoming more brittle or breaking easily, or that your hair is thinning or lacks its usual luster, this could be an early sign of calcium deficiency. While these changes might seem minor, they're often a precursor to more severe issues if the deficiency isn't addressed. Dental issues. Calcium is essential for healthy teeth and gums. A deficiency can lead to more frequent cavities, tooth decay, and even gum disease. If you find that your dental health is deteriorating despite good hygiene practices, it might be worth considering whether your calcium intake is adequate. Your teeth are essentially an extension of your bones, and when calcium is in short supply, they're often one of the first places to show signs of trouble. These common symptoms are important to recognize early on, as they are often the first indicators that something might be wrong. But what happens when calcium deficiency becomes more severe? The symptoms can escalate into serious health risks that go far beyond your bones and teeth. Severe signs of calcium deficiency. Cardiovascular issues. When calcium levels drop significantly, it can start to affect your heart, a critical muscle that depends on calcium to function properly. One of the most alarming symptoms of severe calcium deficiency is heart palpitations or an irregular heartbeat. You might notice that your heart races unexpectedly or feels like it's skipping beats. Over time, this can lead to more serious conditions like arrhythmias, which can increase the risk of heart failure if not treated promptly. If you're experiencing these symptoms, it's crucial to seek medical attention immediately, as they could indicate a dangerously low level of calcium. Neurological symptoms. Calcium plays a vital role in nerve function, and a severe deficiency can lead to some frightening neurological symptoms. You might experience confusion, memory loss, or difficulty concentrating. In extreme cases, low calcium levels can even cause hallucinations or seizures. These symptoms occur because calcium is essential for the proper transmission of nerve signals. Without it, your nervous system can't function correctly, leading to these severe and potentially life-threatening issues. Severe muscle and nerve issues. Beyond the muscle cramps and spasms we discussed earlier, severe calcium deficiency can lead to a condition called tetany. Tetany is characterized by prolonged muscle contractions, often in the hands and feet, but it can also affect the face and other muscles. This condition is not only painful, but can also be life-threatening if it involves the muscles around the airway, potentially leading to respiratory failure. Tetany is a clear sign that your calcium levels are dangerously low and requires immediate medical intervention. Numbness and tingling. Another severe symptom to watch out for is numbness and tingling in your fingers, toes, or around your mouth. This is known as paresthesia, and it happens when your nerves aren't receiving enough calcium to function properly. While it might start as a mild tingling sensation, if left untreated, it can progress to more severe nerve dysfunction, affecting your ability to move and feel normally. This symptom should never be ignored, as it indicates a serious disruption in your body's ability to maintain normal nerve function. Chronic fatigue and depression. Lastly, severe calcium deficiency can have a profound impact on your mental health. You might experience chronic fatigue that doesn't go away with rest, or you might feel a deep sense of depression. Calcium is involved in the release of neurotransmitters, the chemicals that communicate between nerves and the brain. Without enough calcium, your brain can't function optimally, leading to these severe mental health issues. Chronic fatigue and depression can significantly impact your quality of life, so it's important to consider calcium deficiency as a potential underlying cause if you're experiencing these symptoms. These severe symptoms are your body's way of sending out distress signals, indicating that your calcium levels are critically low. Understanding these signs is crucial for taking timely action to prevent further health complications. But what causes calcium deficiency to become so severe? Causes of severe calcium deficiency. Dietary insufficiency. One of the most common causes of calcium deficiency is simply not getting enough calcium through your diet. Many people don't consume the recommended daily amount of calcium, which varies depending on age, gender, and life stage. Foods rich in calcium include dairy products like milk, cheese, and yogurt, as well as leafy green vegetables, fortified cereals, and certain types of fish like salmon and sardines. If your diet lacks these foods, or if you follow a strict vegan or lactose-free diet without proper supplementation, you might not be getting the calcium your body needs to function properly. Malabsorption disorders. Even if you're consuming enough calcium, your body might not be absorbing it effectively. Certain medical conditions can interfere with calcium absorption, leading to deficiency. Disorders like Crohn's disease, celiac disease, and other gastrointestinal conditions can damage the lining of your intestines, reducing your body's ability to absorb calcium from the food you eat. This malabsorption can result in low calcium levels, even if your dietary intake is adequate. Additionally, surgeries like gastric bypass can also affect calcium absorption, putting individuals at higher risk for deficiency. Hormonal imbalances. Hormones play a crucial role in regulating calcium levels in your body. One key hormone involved in this process is parathyroid hormone, PTH, which controls the amount of calcium in your blood. Conditions like hypoparathyroidism, where the parathyroid glands produce too little PTH, can lead to dangerously low calcium levels. Another condition, hyperparathyroidism, can cause the body to lose calcium through the urine, leading to deficiency over time. Women, in particular, may experience calcium deficiency during menopause due to decreased estrogen levels, which affects calcium metabolism and bone density. Vitamin D deficiency. Vitamin D is essential for calcium absorption. Without enough vitamin D, your body can't absorb calcium effectively, no matter how much you're getting from your diet. This is why vitamin D deficiency often goes hand in hand with calcium deficiency. Lack of sunlight exposure, which is the primary source of vitamin D, or not consuming enough vitamin D-rich foods like fatty fish and fortified products, can lead to low levels of both vitamin D and calcium. It's important to ensure you're getting enough of both to maintain healthy calcium levels. Medications. Certain medications can also contribute to calcium deficiency. For example, long-term use of corticosteroids, often prescribed for chronic conditions like asthma or arthritis, can interfere with calcium absorption and bone metabolism. Diuretics, which are commonly used to treat high blood pressure, can increase the amount of calcium excreted in the urine, leading to a drop in calcium levels. Additionally, some anticonvulsant drugs used to treat epilepsy can also affect calcium and vitamin D metabolism, increasing the risk of deficiency. If you're on any of these medications, it's important to monitor your calcium levels and discuss supplementation with your doctor. Understanding the causes of severe calcium deficiency is the first step in preventing it. Whether it's due to diet, absorption issues, or medication, to sum up, calcium deficiency is more than just a matter of weak bones. It's a serious condition that can affect your entire body, from your heart to your nervous system. We've covered the common signs like muscle cramps, brittle nails, and dental issues, as well as the more severe symptoms like heart palpitations, neurological disturbances, and severe muscle spasms. Understanding these signs is crucial, because catching calcium deficiency early can prevent it from escalating into a serious health crisis. If you found this information helpful, please give this video a thumbs up, and don't forget to subscribe to the channel for more health tips and information. I also encourage you to share this video with friends or family who might benefit from it. Knowledge is power, especially when it comes to our health. And if you have any questions or personal experiences with calcium deficiency, feel free to drop a comment below. I'd love to hear from you and help out where I can. Remember, your body is constantly sending you signals. Don't ignore them. If you're experiencing any of the symptoms we discussed, take action now, whether that's making dietary changes, adding supplements, or scheduling a visit with your doctor. Your health is your most valuable asset, and taking care of it should always be a top priority.